Hi, good afternoon. My name is Maria Sainz. I'm the president and CEO at Hyperfine Inc. So I was born in Spain. I was born in Madrid. I went to school and studied linguistics at the local university, came to the US to get an MBA, and I have been in the medical technology business for over 30 years. I'm currently the president and CEO at a publicly traded company in health tech called Hyperfine. So there was a little bit of a dream and a little bit of a tantrum. I had finished school in Spain and I really wanted to try something new and fly from the nest. So I got into medical technology after I graduated from college. I actually went into healthcare, pharmaceuticals first, and that company had a division in medical technology that I wanted to try and work in because it moved faster than pharma. So I started my career with a lot of commercial assignments and jobs. I did a lot of selling that I think created who I am as a leader. And I evolved from selling into marketing, into general management, and from general management at a large company into CEO roles at smaller companies. I want to join board of directors where I can bring something to the table. So where I feel that what the company is doing and what the company needs fits what I can contribute, the experiences that I have had. It is also very important that the chemistry with management and the chemistry with the board is a healthy one so that you are in a forum where you can agree to disagree and you can handle conflict comfortably. Clearly coming to the US. I don't know if you have had an MRI, but getting an MRI is a big deal. You are in an isolated chamber. You usually have to get on a wait list to get it. And it's a relatively intimidating activity that requires a lot of planning to happen. Portable MRI allows for the MRI to happen at what we call the point of care. So it can be in the ICU, it can be in an emergency department, it can be at a neurologist office. Anywhere where the patient needs it, the portable MRI can make it happen. What excites me most is the opportunity to contribute to really big neurological problems, since our technology is used to find people that have strokes or to monitor people that have neurodegenerative diseases like dementia, Alzheimer's, multiple sclerosis, and those are really big, debilitating conditions that affect a lot of patients on a worldwide basis, their families, as well as cost a lot of money to healthcare systems throughout the world. So what is next for Hyperfine? Hyperfine has been developing just a portable brain MRI, but what we have is the ability to produce very high quality clinical images from a very low field magnet. And I believe that has a lot more potential than just portable brain MRI. We could pursue other anatomies. We could also think about intraoperative MRI. We could also think about putting an MRI in a Walgreens, in a pharmacy, where we would all just go get screened for any kind of brain condition on a routine basis. The biggest challenge is medtech is all about innovation. Innovation requires risk-taking and requires capital. So in today's environment, the ability to bet on medical innovation is challenging because it has a lot of, it doesn't have perfect predictability, and it also has to go through lots of gates. You have to go through FDA, you also have to secure reimbursement, and then you have to actually make it commercially successful. The most important thing for a successful medtech company is a highly innovative and proprietary position. So you have to be unique and you also have to bring value through innovation, making patient care better, making it more streamlined, making it more affordable. Those are all potential consequences of innovation. The best advice I've ever received is to take risks. The US is a very large market, but it's also very fragmented. So there are academic institutions, there are community hospitals, there are payers. So it's a very complex healthcare market that needs to be understood carefully. The fact that it is close to 300 million people is very compelling, but it is very fragmented. Anything dealing with a streamlining of teams, right-sizing of teams, hiring or firing people have been the more difficult decisions. I believe that you have to have the right team to success, but getting to the right team is probably one of the more difficult decisions.